C has been something I've been interested in for a very long time. And Hep C doesn't affect all populations equally. As you start to treat people over time, you recognize that there are certain groups of individuals who are more represented in your clinic or that you meet in the community more frequently than other people. And the corrections population clearly is one of those groups. And not only did I recognize that they had Hep C, which is an important infectious disease, and it was a big problem within that community, I also recognized that they don't always get great access to the new treatments, or the old treatments for that matter, at a federal or provincial level. And not only that, people don't get to be in research studies. And I think that's somewhat intrinsically wrong that no one ever offers them that opportunity. And so that's what brought me to Hep C, corrections, and research altogether. Is should we be doing this sort of research in a dedicated corrections population from an ethics point of view? And we've gone through a lot of trouble to make sure that we actually put in a lot of safeguards ethically, but also that we evaluate as we go along. We haven't done this in a long time. I think it's the right answer to include people. I think it can be done ethically, but I don't know. I think the answer is going to be yes. If you really want to impact what's happening in the community, you really need to get down to the provincial corrections level where people are in and out in the community all the time. And you really want to get Hep C cured and reduce the burden in the community as well as the correction center. So this wasn't the easiest process, I would say. We had a very strong partner in the PEI government. They actually were advocating for their offenders the whole way along. They wanted to make sure this was done well, done ethically, but they were still wanting to provide excellent health care and state-of-the-art treatment and access to research opportunities for their offenders. So number one, you need a willing partner at the government level. And how do you build that? Well, I think you help them make opportunities for it to be a good thing for them. You reduce hepatitis C, you reduce risk for staff, you reduce the risk of people coming back in and needing expensive harm reduction programs if they've already been cured and they've already found harm reduction in the community. And you need a partner at the industry level sometimes to help you get some access to either free or reasonably priced drug. Then you need some people from the corrections side of things, people who are willing to advocate for themselves and for other people in the correction setting. But the key things here that made this happen, honestly, were that we had a motivated government partner, but a diligent one, and we had a motivated industry partner along with the science team that really wanted to do this.